I'm Alan Doederlein with the Depression and Bipolar Support Alliance, and we're talking about medication side effects and your relationship with your doctor. Thank you for joining us.
Thank you.
How do you create that relationship with your patients? How do you make sure that they understand they can be that honest with you, that they can reach out, and that you're not going to say, oh no, you have to take that medication even if it has a totally disruptive side effect? How do you create that alliance?
And in terms of the medications, we have very effective treatments to treat the entire illness. The goal of treatment with medications is obviously to have the illness under control, to treat all signs and symptoms, treat it to full remission. I approach this like I would if somebody had diabetes, if they had cancer, an infection. You want every symptom wrung out. You want to do everything we can to avoid those symptoms. Now, obviously, medicines are less than perfect. We do know that medicines can have side effects. And the best approach is for clinicians and patients to work in that relationship together. Because as a clinician, I like to think I could give someone a medicine and feel like they're not taking anything other than if their mood stays stable. If someone does have side effects, I encourage the individuals to communicate that with their physicians. Communicate what the side effect is. If it's bothersome, if it's keeping the illness under control, if they can live with it. One of the things I've learned over time working with patients with any psychiatric disorder, if they're coming in for the first time, there may be shame, there may be stigma, there may be embarrassment, they may be afraid. They don't know what to expect. And so I think the best approach is to let them know from day one that what happens in that office and that relationship between that individual and myself, we have to maintain confidentiality. Very early on for many of my patients, I try to create that relationship and that alliance with them to open up to me, to communicate anything that they're not satisfied with, which could include the side effects to medicines. I may, for some patients, go on overkill to describe every possible thing that could go wrong, and then say, but on the other hand, the common things that may come up may be X, Y, and Z, but this is how we may deal with it. Patients, and I've been a patient too, I know what it's like to take a medicine, whether it's an antibiotic or something else. I don't like surprises. And so it's always good for the individuals to ask, what can I expect if the doctor doesn't volunteer that information? Because if someone takes a medicine and they have a side effect that they didn't expect, there's a high likelihood they may not take it anymore. And so I encourage patients to discuss it with me, bring it back in. If they're keeping a life chart or life diary, write it down. And it's not uncommon that people will come in after they start a medicine and say, oh yeah, I did have a little stomach upset, but it got better. But they weren't surprised, they weren't disturbed by it. But if it is something, whether it's a weight gain issue, whether it's a sexual side effect, I go right there and put it on the table because I don't want people to be surprised early on, but also later, because some of these side effects can be almost late onset ones, such as the weight gain and things like sexual side effects if they are present.
In addition to that sort of late onset of side effects, sometimes you experience the side effects before you get any therapeutic benefit. How do you help your patients stick with it?
One of the challenges, obviously, is for someone if they have side effects before they feel the benefit of the medicine. And so I think letting individuals know some of these medicines may take time to work. If you have side effects, I give them the game plan, what maybe the target dose may be. And letting them know this is where we may be going, but if you're having side effects, we may go a little slower. But I encourage them to be a participant in this with me.
What are some of the concrete things a person can do to establish that relationship from the start?
If someone does have side effects, I encourage the individuals to communicate that with their physicians. Communicate what the side effect is. If it's bothersome, if it's keeping the illness under control, if they can live with it, there may be ways to manage the side effects. However, if an individual finds their doctor isn't listening or not paying attention to it, it's always good to get that second opinion. Having that open dialogue and prompting that with clinicians, because the reality is these days clinicians are busy. And sometimes patients will feel pressured. They'll feel like the doctor may not be spending enough time, but ask the questions. Come in, have them written out. I find it helpful when people have it written out, whether it's on a life chart, a diary, whatever it is, or they hand me the list, because it really helps organize it. And we get a lot done in that time.
What are some other strategies for coping with side effects?
In terms of strategies to cope with side effects, one is never stop a medicine unless your doctor knows. Don't try to lower the dose without having that communication with your healthcare provider. But because there are a number of strategies. Sometimes a lower dose, sometimes spreading the dose out. Sometimes it may be a matter of switching to something else. If something isn't working so well, you may sit down and talk to your doctor about, is it really worth a side effect? I've been on this medicine for 6 months and it's really not doing everything I expected. That may be a matter of switching to a different medicine. If something is working superbly and everything is under control, and if it's a minor side effect, sometimes using something to treat that side effect could be helpful.
Frequently with bipolar disorder, you see substance abuse or misuse, you see alcohol use or overuse, and that can be difficult to share with your doctor. You know perhaps that you shouldn't be using substances the way you do, but what do you suggest for dealing with that kind of information in the doctor's visit?
One of the things that I think individuals may struggle with is the fact of feeling shamed or embarrassed by saying that they may be drinking alcohol, smoking cigarettes, or using recreational drugs. We know as clinicians that it's very common in people with bipolar disorder to have a history of substance use disorders. We as clinicians sometimes just assume it is the case. So I don't want people to feel embarrassed or ashamed, because part of a good management and getting this illness under control is making sure that the abuse part of those substances doesn't occur. And being as open and honest with your healthcare provider is something that certainly I can tell you as a physician I appreciate. I encourage people to put on their diaries or their life charts alcohol, tobacco, and even if they do recreational drugs, I'd rather know than not know. And I will ask people, how many drinks do you have? What size are those drinks? Because, a lot of people tend to rationalize and say, well, I have 2 glasses. Well, are those 2 big glasses or 2 small glasses? But to be as upfront, because that's the partnership you have with your healthcare provider. That healthcare provider should be there for the individual to utilize in the best possible way. And honesty and being open about those things is what's going to result in the best outcomes.
Great. What about the things you can do besides taking your medication? We know we shouldn't switch medications or stop taking medications without consulting with the doctor. What about the things we do in addition to adhering to the regimen? What can we do to keep ourselves well besides taking the medication?
You know what, in terms of keeping this illness under good control, especially once the mood is stable, it is going back and taking an inventory again about what it is for you as an individual that will keep you happy and healthy and satisfied, even in life stressors, the good stressors and maybe even the not so good stressors. But bottom line is to take care of yourself. Sleep is up there, number 1. Good sleep hygiene. Trying to avoid drinking alcohol or using substances in excess, moderation, not to overextend oneself. I believe in exercise and good physical activity as best as you can, and taking care of all medical needs, because we do know if you ignore your medical needs, one will feed off each other. And so taking an inventory over time of what's important in your life, and finally what to build into your life. Now that you're well, what was it that you wanted to do when you weren't feeling so good? Go back and take an inventory of what those things are. It may be going back and taking that class or finishing that degree. It may be going back and trying to date again, or whatever those things are, taking an inventory of that, because that's what life and the richness of life should be around when one feels well.
Dr. Zajecka, thank you so much for being with us. Appreciate your great insights into treating and dealing with side effects of medications for bipolar disorder.
It's my pleasure to do this, and hope that I left some impact for anyone and as many people as possible today.
Thank you for being with us.